Autism affects at least 1 in every 25 children in the country, according to the Autism Society of Kenya. This is 4% of the population, translating to about 2.2 million people, placing Kenya at the 46th position globally. That figure is far higher than the global average of 1 in 160 children, according to the World Health Organization. Experts warn that underdiagnosis, lack of trained therapists, and limited inclusive schools are major barriers to care. Autism spectrum disorder, ASD, is a neurodevelopmental condition that affects how a person communicates, interacts socially, and behaves. It is called a spectrum because it presents differently in every individual. Some people have mild challenges while others may need significant support in daily life. And for the caregivers of children with autism, they have been thrust into a life they never anticipated and are fighting a silent battle. Caring for a child with autism often means facing stigma, isolation, and crippling financial strain. In towns like Kisumu and across rural Western Kenya, families raising children with autism navigate a healthcare system that is under-equipped, schools that exclude, and communities that do not understand. From expensive therapy to the pain of watching a child denied school placement, the burden rests almost entirely on caregivers, where most of them are mothers. Meet Florence Nyawara, a single mother of 2 who juggles teaching, motherhood, and full-time care for her son Gian Jabali, who was diagnosed with both autism and epilepsy.
Throughout the pregnancy, it was okay. I attended all the antenatal clinics. Kila kitu ilikuwa sawa. So when Jabali turned 1 year old, he started having convulsions. So we rushed him to the hospital. The convulsion was managed. He was put under medication. We went back home. After some few months, I started noticing things. He was not behaving as the other kids his age were behaving. For example, he was not able to communicate. Toilet training as well. We were not able to do the toilet training. He was so comfortable with being with the poop, and then social interaction as well. He used to play alone, do everything alone, not noticing whether I'm there or not.
After assessments, the doctor told her the child was fine and that he needed more time. But during a church function, a friend quietly pulled her aside and suggested it could be something called autism, a word she had never heard before. That night, she stayed up reading everything she could.
It's really hard to accept because it took me time. I broke down, I cried, and then being a single parent, handling a child with autism, it was not easy. So this is a child who has autism and as well as epilepsy. So it was hard in terms of, because these children need therapy for them to be able to adapt to or to be able to live with other people. They need to go for therapy. And these are children who, like my son, we use diapers. You're still not able to. Yes, okay, I'm trying to do toilet training, but before that, this is a child who is still in diapers. This is a child who is on medication, and so you can imagine the drugs being expensive, the diapers being expensive. So it's not easy. And what has really worked on for me is my family. I have a very big support system, that is my family, because I'm a single mom and it's not easy, but my family has been there for me, chipping in 1 or 2 times when the drugs are not there, because with epilepsy, you can't miss the medicine, because this drug is taken on a daily basis, so you can't miss in the morning and the evening. And this is a child you take for checkups and as well as therapy. So it's so hard, it's expensive. It's really expensive to take care of these children.
Adhiambo's sister, Sarah Akinyi, has helped raise Jabale since infancy. The family's journey into autism care began with confusion and heartbreak.
At around 8 months, I noticed that he couldn't sit up on himself. And he didn't wouldn't notice her mom, or he didn't notice anything. So anybody would take him, anybody would play with him, anybody would stay up. He couldn't notice the mom. And when you put him to stand, he couldn't even stand like the other babies do on their normal journey growing up. So that's where we were like, no, this is not it. So her mom went into everything, and that's when actually all our family needed to know what autism was. We never heard of it, we've never seen kids with it or people with it.
In desperation, the family once turned to traditional healers, spending money, time, and hope until they accepted that only consistent therapy and love could help.
Umeenda 1 week na mtoto na umejua hizo madawa za kienyeji tunaambiwanga sijui situmie na nini na dawa za sasa. Umejua uko frustrated. Kila mtu, babangu anataka kwa mzuri, mamangu anataka kwa mzuri, my sister anataka kwa mzuri. Tukirudi ndio nini conversion zilirudi kidogo na kaacha kukua hyper, but hakuwahi pona.
In Migingo village, Kisumu West, Benta Adhiambo's life is a careful choreography balancing care, stigma, and survival. She takes care of her 10-year-old son Joshua, a child full of energy yet locked in a world few understand. From cataract surgery as an infant to years of strange behaviors no one could explain. Joshua's journey through misdiagnosis, rejection, and stigma reflects the painful reality of raising a children with autism in rural Kenya.
3 years hivi alikuwa anatembea anapotea, mara amepotea, anatafutwa hivyo tu. Sasa nilijua huyu mtoto akuna shida gani, kuongea pia ongei, na wengine walikuwa naniambia ataongea tu, wengine waongea na 3 years, wengine wanaongea. So nikachukua ni sawa. So there's a friend of mine alikuwa anafanya Lutheran, ni mwalimu, Teacher Elizabeth Bunde. Akasema si huyu ni rafiki wa ati huyu mtoto ni wa nani? Akaambiwa huyu ni mtoto wa rafiki yako. Kaniambia sijajua kuna mtoto kama huyu, hebu mwambie nitafute. Ilibidi niende kwa yeye, akaniambia huyu mtoto peleka assessment Joyland. Akasema tuombe asikue na hizo signs za autism. Nikamuuliza autism ni nini? Ati wewe peleka tu mtoto nini. Kupeleka tukapewa hiyo nini inaitwa form ya kujaza, na zote Joshua scored 8, ambayo waliniambia ana develop autism. So nikaambiwa wamweke diet. By then Joshua kwa anapenda kukula chochote, ni tu mchele ndiye alikuwa anashinda akikula. Saa zingine hakuna, ukimpea chai ya maziwa ananusa, anawacha. So vile walikuwa wameniambia niende nimweke kwa diet, I was confused, sijui cause kumweka kwa diet nitamweka aje na yeye chakula yake ni moja ambayo ni mchele.
But therapy stopped when money ran out. Joshua now receives no regular medical attention, his mother relying on public hospitals that cost less than the price of a meal but demand time, patience, and luck. And in her village, whispers never stop.
Majirani wanasema huyu amelaaniwa, wengine huyu tumetengeneza nayo mali. Sasa hapo nayo wanaongea, lakini yao siyasikii kwa sababu naona ni Mungu ndiye amenipa huyu mtoto kama huyu. Sasa umejua saa zingine Joshua anapenda maji. Akikosa maji kwa boma ataenda the next homestead pale. Sasa hapo saa zingine akienda achote maji kwa mtu, huyu atamchapa. Sasa hapo ndiye nasikia sasa mbona amchape? Si angemwambia tu ache kutumia aniite nikuje nimchukue.
Although Kenya lacks a formal national policy specifying the recommended number of autism specialists, global health standards suggest a minimum of 23 skilled health professionals per 10,000 people to ensure adequate care. Given Kenya's population of approximately 55 million, this will translate to about 126,500 health professionals. We meet Sharon Amolo Ocholo, a caregiver and a psychologist, together with her husband, Francis Odhiambo Owino.
I started realizing that there was something different about Tariq, and I used to tell my husband that Tariq seems different because when you call his name, he will not respond. His social interaction was different. He was a loner. He will play alone. He will not respond to any call, reaction, or anything. So I started getting worried as a mother. Then I asked one of the doctors, and they were like, take him to Russia, which is Jotiarech. Let him be assessed, and you'll be told if there's any condition or disorder that he has.
Sharon Amolo recalls the emotional turmoil she faced after giving birth to twins. The weight of responsibility felt overwhelming. At first, everything appeared normal. But at just 10 months old, one of the twins, Tariq Frank Odhiambo, began crying incessantly.
When we went to Russia, they suspected autism. There is no full diagnosis that was done, but they were suspecting autism, so we were told to start occupational therapy. So it was an early intervention of like a year and some 8 or 9 months. We started Tariq on occupational therapy, Russia. In occupational therapy, they will do play therapy, they will try to build his intellectual, they will try to normalize everything for him to understand that this is the normal way things should happen. And the sensories will also be helped because there are some balls and some therapies that are being offered there that helps with Tariq. So even schooling is a problem because for them, for autism, they tend to learn slow. They are slow learners. So when a teacher has a class of like 30 or 25 students, he will not be concentrating on one person because, again, most of these autism characters you'll find they have ADHD, which is hyperreactivity. So he will not settle. And being that he will not settle, that attention he will not give you. So that is what now the occupational therapy is trying to do, building that attention, building that settlement, so that at least he will be able to grasp something for the meantime that he's settled. So yes, schooling is a problem, but right now we found somewhere Tariq is going, he's being managed. Diet is also an issue because with Tariq, okay, as much as he'll eat almost everything, but there are some things when nutritionists will tell you that they're not supposed to eat, like persimmons and gluten. So we try to limit on the normal milk. We try to limit on the dairy products. We try to limit on the wheat intake. We try to put him on veggies and maybe white meat.
He is still nonverbal, but he's learning in his own way. They have milestone thanks to therapy and routine. Sharon, who went to school to study psychology so that she can be able to take care of her son, says the children need support for them to live to their full potential.
When you accept as a person, as a caregiver, you are able to now explore so many options of how to help this person. You are able to walk into these offices and doors where you will get help because knowledge is there and it is power. And two, now at the point of now diagnosis, occupational therapy is key, and twice a week will help more. In the occupational therapy is going to be help with the sensory, is going to be help with attention, is going to be help with so many things, and the play therapy that also helps with the brain development. And now three, the diet, the way we've talked about, and accepting this child and helping this child or this person emotionally is also very important, and physically, when now is in a point where maybe he cannot use the washroom comfortably. Now another thing that helps with autism is routine. Build a routine for this child, build a routine for this person, so that, because they work well with routine. Once they know in the morning I wake up, I will do this, then I do this, then I do that, it helps their brain to now do because they have repetitive behavior. So the moment you repeat that thing, he or she is able to pick that this is the right thing I'm supposed to do. Again, give this child a normal environment. Normal environment means that don't hide this person, don't be stigmatized by whatever who and who is going to say, because the more you put this person in an enclosed environment, he is not able to grow naturally, is not able to pick the natural ways of growth. So bring this person to the natural environment, to people, so that he may associate with people, know how the normal people behave, because they learn by seeing.
Typical Kenyan classroom of 40 pupils, at least 10 may be living with unseen challenges of neurodevelopmental disorder, giftedness, learning disabilities, but many are slipping through the cracks. Brenda Achich Ishmael is a special needs trained teacher who has taught across public, private, and special institutions. She says while children with mild autism are occasionally seen in mainstream schools, those with severe forms are often hidden, locked away in homes far from classrooms and playfields.
I encountered a learner who was autistic, and it's always hard to find them. Why? Because they are always kept in, they are hidden, I'll say they are hidden, not part of the society. Ni ngumu hata kuwapata classes, like they are incorporated in classes. Utapata wenye autistic wenye wanapatikana class ni mild autistic, at least them that love the books, but them that hate books, them that show out tantrums, utapata they are hidden in their homes. When I met this learner, I called the parent, and the parent was not so open with us that the learner is autistic. You're profound. So there are stages of disabilities: mild, profound, and extreme. So kuna wale extreme wenye wanakuwa sasa hidden, contained in the homes. Like recently I've met wale extreme kept at homes. When they see an individual, they scream, throw tantrums, want to bite you. They hate visitors, they want to stay in their own corner. Those are such extreme. Now mild sasa ni at least a bit favorable.
Despite 60% of the country's schools claiming to support inclusive learning, Brenda says the reality is different. Public schools lack trained special needs teachers. The government expects regular teachers to adapt. It's a tall order in a 40-minute lesson with overcrowded classes. Dr. Lola Mola, a pediatric emergency and critical care specialist at Jaramogi Oginga Odinga Teaching and Referral Hospital, says early detection of autism is key.
So how we normally classify it is that you can have somebody who has just mild autism, moderate autism, or even severe autism. So that means depending on how severe the disease is, then it depends on how soon we should be able to identify it. So for those who have severe symptoms, these are the ones that we are able to pick them up a little bit more earlier. So those who have moderate will be picked along the way, and those who have mild form of it might actually not be picked, or might be picked later on in their lives. So how early can we diagnose autism? Remember, this is usually a diagnosis where we are looking at the development of the child, hence the neurodevelopment, and we're looking at how the child is interacting with other children, with the environment, and with the caregivers or with the parents. So the earliest usually when we expect interdependence, where the child is able to do these things, is usually from around 1 year, 6 months, but comfortably we like having that diagnosis from around 2 years of age. Why am I saying from as early as 2 years of age? Because at that particular time there are things that we must have achieved, what we call in medicine milestones, the things that we expect that this child should have attained by this particular age. So going backwards. So if a child is born, they're not able to do a specific things. By the time they get to 6 months, you expect that they're sitting down. By the time they get to 7, they're crawling. By the time they get to 1.5 years, we expect that they should be walking without support. Now the issue of speech also comes in. So there are words that we expect. From 6 months you could be blabbing 1 or 2 words. From around 8 months you could be saying a couple of words. By the time you get to around 18 months, then you should be able to say monosyllabic words. These are things like mama, baba, bye, pe, chapa, depending on which language the child is exposed to. So when we have a delay in any of this, whether it is motor in terms of the milestones or it is speech for the speech delay, then we are able to make up that diagnosis. And then the other aspect is then now how then do they interact with themselves and with the environment, and that's when the other things like temperament comes in, and probably we'll discuss the signs and symptoms to look out for. And then there are people who don't want to be in a crowd, they tend to elope and they tend to be just secluded in a specific place. So to answer your question, basically from around 18 months going all the way till 24 months, then at that particular time, for those who have severe signs, then you should be able to have picked it up by that particular time.
But when a child misses these milestones, whether it's speech, movement, or interaction, it could be more than just a delay. However, she says, lack of data has made it difficult for government to make policies geared towards management of autism in the country.
One of the problems that we have is lack of data. And one of the things that you've done even nationally, not just as a fertility, is to ensure that autism is made as part of the diagnosis in terms of the ICD diagnosis. So once I key in autism as a diagnosis, it should be able to give me an ICD-10 number, which can be cross-referenced in any facility. So we are training our healthcare providers, whether it is the nurses, the clinical officers, medical officers, any healthcare provider, that once they are able to identify autism as part of the diagnosis, then they should be able to key it in. So once I have that patient keyed in as under autism, for example, then I'm able to get all the data that pertains to this patient. So if I'm going to inform policy, one is that I'm able to count numbers numerically. I can identify in terms of biodata, in terms of how many males are affected, how many females, and what's the age group. And even it will also help us in terms of if we are identifying them early, then that means we have data that pertains to these patients. We are able to follow them up for whichever number of years. And this means I can actually use this data to argue out a point at whatever place. So whether I'm going to the ministry or whether I'm approaching the county government or the national government, I'm actually using data to inform policy, which will therefore inform decision making.
Underdiagnosis and late diagnosis deny many children the benefits of early intervention, coupled with a severe shortage of autism-specific services, trained therapies, and inclusive educational facilities, making care both inaccessible and unaffordable for most families. For Willow Stories, I am Sarah Kamande.